Welcome to my show today. How's everybody doing?
Very good, thank you.
Today we're gonna have a great show. Our topic is gonna be on intraocular lenses. Assistant! Intraocular lenses, also known as IOLs, is used to treat varieties of eye diseases such as cataracts, astigmatism, and presbyopia. Currently, 20 million people worldwide have cataracts. Cataracts is the main cause for vision loss for seniors. However, 97% of the 3 million cataracts procedures are successful, and 95% of the patients have normal vision after the cataract surgery. In the U.S., approximately 2 million IOLs are implanted per year. Now, let's please welcome the expert eye doctor, Dr. Ozzy!
Hello everyone, I'm Dr. Ozzy. Thank you for having me, and it's great to see you again, Oprah. I love your new hairdo. I'm here to tell you about intraocular lens. There are three types of IOLs: monofocal, multifocal, and accommodating. With monofocal IOLs, the patients can clearly see in one zone but still require glasses when viewing objects at another range. Multifocal IOLs typically produce a higher amount of optical aberrations but have the ability to clearly see both objects near and far. Accommodating IOLs mimic the natural structure of the eye so patients can see near and far, and is the most risky IOL to implant. The Food and Drug Administration has classified IOLs as Class 3 due to its invasive implantation during cataract surgery.
Thank you, Dr. Ozzy. It's always a pleasure to have you in our show. Now, let's welcome our unfortunate guest who has this type of disease and problem. Let's welcome Mr. Dr. Cataract. Now, Mr. Cataract, over here. Now, Mr. Cataract, please tell us about your problem.
Well, it happened a little while ago. I was a photographer. It was my entire life taking pictures. I realised I started having a problem, you see, because I had a spot in my vision, and it was quite blurry, and I couldn't differentiate between my beloved Volkswagen and my cat. Anyway, I went to see the doctor, and he told me that I had a condition called cataracts, and recommended some kind of surgery, implanting something or other in my eye. So I decided photography was my passion enough, I needed to get it. So we got the surgery, and went terribly wrong, and now I can't see anything. I'm sorry, that's all I'm going to be able to say.
Well, the important thing is okay, because today is your lucky day because we have 4 major companies to solve this type of problem. Let's introduce our first 2 companies.
Hi Oprah, thank you for having me. I'm Albert Connor. You can just call me Al.
Nice to meet you, Al.
Hi, I'm Abby Boss from Abbott.
Nice to meet you.
And I'll go first, Mr. Oprah. Alcon has been a leading company in eye care. With more than 50 million implants in cataract surgeries, Alcon's Alcasoft family of lenses are the most frequently used in the IOL. Unlike other commercially available IOLs, which are made of either silicone or hard plastic called PMMA, Alcasoft is composed of a soft, foldable, biocompatible hydrophobic acrylic, which makes implantation much easier by requiring smaller incisions and thus eliminating the need for stitches and reducing recovery time. One of Alcon's multifocal line is called Alcasoft IQ Resistor IOL, which is suitable for patients with cataracts and presbyopia, a disorder that decreases the ability for the eye to focus. Our IOL was FDA approved in 2005. A lot of IOLs available offer UV protection from sunlight, which could damage the retina. All of our IOLs offer similar filters, not only from the sun's harmful rays, but also from artificial light such as fluorescent bulbs, as well as high blue light that could cause macular degeneration of retinal damage. Our design uses the strengths of apodized diffractive and refractive technologies that reduce the need for glasses or contact lenses. Apodization is the gradual smooth tapering of different diffractive steps from the center to the outside of the IOL, causing light to blend, refocus, and provide proper vision distance.
But what are the risks for this particular type of IOL?
Well, with any surgical procedure, there is some risk. Although they only occur in less than 5% of cases, some risks include corneal edema, which is swelling and increase in intraocular pressure. Other complications include wound leakage, renal detachment, where there is a tear in the retina, allowing ocular fluid to seep in behind the retina. A major post-op complication is posterior capsule ossification, PCO, which results in blurry vision due to growth and migration of residual epithelial cells onto the posterior capsule that supports the IOL. Acrylic is inert as a biomaterial, but having surgery promotes the growth of these epithelial cells as a biological response. This can be treated with a simple procedure called YAG posterior capsulotomy. YAG is a type of cold laser that creates a small opening in the center of the capsule, allowing light to clearly enter the eye. The aim now is to improve the material by preventing PCO, but perhaps providing a coating that doesn't encourage lens epithelial growth onto the capsule.
What about your company, Miss Abby?
Well, we at Abbott Medical Optics offer a variety of IOLs, but I want to specifically talk about our monofocal Technis aspheric IOL, which is available in both silicone or acrylic with haptics, which are the struts that hold the lens in place, composed of PMMA. Our unique aspheric lens has claims approved by the FDA for reduced ocular spherical aberration to essentially zero, thus restoring a more youthful look similar to that to a 19-year-old's vision. Our IOLs enable the full transmission of visible light and has effective UV protection that doesn't block out the essential blue light, unlike our competitor, Alkaline. Blue light is essential for scopic vision, low light vision, which is important especially when driving at night. It also helps regulate the circadian rhythm, which influence mood, sleep patterns, alertness, and body temperature. Both of our next-generation silicone and hydrophobic acrylic Technis aspheric IOL are composed of the clearest vacuum-free materials of all foldable IOLs tested. This is due to our unique manufacturing process called cryolating. Cryolating is performed on frozen lenses. Each lens is crafted individually to ensure the precise manufacturing of the diffractive surface. We don't use molding like our competitor Alkaline, because molding at high temperatures can lead to imperfections such as vacuoles or glistenings, which have been associated with hazy vision and acuity loss. All of our IOLs are hydrophobic, which prevent protein adsorption to its surface that could reduce vision quality. This IOL features our OptiEdge design that has a round anterior edge to scatter light, sloping side edge to prevent glare, and squared posterior edge that facilitates 360-degree capsular contact that serves as a physical barrier to prevent epithelial cell migration that could lead to PCO.
But why do you offer your IOLs in two different materials?
I'm over here. Well, our aspheric IOL is available in two material platforms because both biomaterials are very biocompatible and the material properties are suited for IOLs. In some rare cases, people may be allergic to silicone, so we have the acrylic option available for them. So it's important to consult your physician to determine which IOL is right for you. With any surgical procedure, there are some risks.
What risks?
Well, adverse events occurred at rates between 1.6 to 3.3% during clinical trials for lens dislocation, macular edema, which happens when blood vessels in the retina are leaking fluids, anterior lens tissue on-growth, and secondary surgical intervention.
Thank you. And we'll be right back after these commercials. Welcome back to the show. Now we got two more companies to introduce to you guys. Here they are.
Hi Oprah, I'm Sparkle from Star. It's so nice to be here.
Nice to meet you.
Hi, I'm Bella Long from Motion Loan.
Hi, nice to meet you. Go ahead, Mr. Arak. Ask them any questions you would like.
Hi, Sparkle. So what IOLs do your companies offer?
Well, Mr. Rock, our company offers many IOLs for cataract surgery, but I would recommend two types. Our NanoFlex Polymer Aspheric Singles Piece IOL and our Elastomide Silicone Aspheric IOL. Our NanoFlex lenses are very hydrophilic, highly compressible, so it can be delivered into the eye by a small incision size. Studies have shown that patients with polymer IOLs implant tend to have fewer instances of higher order aberrations than patients with acrylic and other lenses. The NanoFlex is made from 100% pure collagen and copolymer, giving it the name Collamer. Another polymer used in the NanoFlex is the polyhema. In addition, the IOL also has a chromophore, which is a UV light absorbing material.
But is it biocompatible?
Yes, very much so. Polyhema is a well-known polymer that is chemically inert and very biocompatible. In addition, the collagen also reduces protein adherence on the lens surface due to a light negative ionic charge. The polymer also attracts fibronectin, which forms a layer around the lens, which shields it from being attacked by the body's immune system.
What are some drawbacks of this IOL?
Well, since its polymer is a relatively new development, long-term biocompatibility issues are not known and have not been documented. Furthermore, the biomaterial polyhema has some noted disadvantages, including decreased lens strength and durability. You can increase the strength of the polyhema by bonding different subunits to it.
Is the Collamer lens FDA approved?
Our Collamer IOL have just completed the clinical trial and we have submitted the results and waiting for the FDA approval.
And what about the elastomide lens?
Yes, elastomide lens. Our elastomide IOLs are made from silicone, which greatly reduces spherical aberrations as well. Spherical aberration results from 2 focal points instead of 1 on the retina. Silicone also has covalently bonded UV absorbing properties. With this lens, you will be able to see both far and near distances.
What are the disadvantages and risks of this IOL?
This device is currently not FDA approved, and it has been found that silicone IOL surfaces adhere bacteria, cells, and silicone oil, which unfortunately causes inflammation and IOL desaturation. In order to improve this, we could look into the surface modification of silicone IOL by coating it with a phospholipid-containing monomer.
Sounds promising.
It doesn't sound promising, it is promising. In fact, we have a 99% customer satisfaction.
Well, what about your other 1%? What happened to them?
Oh, okay. Well, Bao, what do you guys have to offer?
Well, Bausch & Lomb provides many products for eye care. We are proud to offer our first FDA-approved crystal lens accommodating IOL, which helps treat cataracts and presbyopia. Crystal lens was modeled after the human eye and dynamically adjusts to your visual needs. It accommodates like the natural lens. Patients implanted with crystal lens could see better at all distance than patients with standard IOLs. In addition, patients will see brighter and clearer across a wider range of distances. Many patients have reported excellent vision after 7 years of implantation with crystal lens. There are more than 200,000 crystal lens implants worldwide, and that number is growing daily. It provides a broad range of vision. Many patients hardly wear glasses after surgery, unlike multifocal lenses. This IOL directs all available light received by the eye to a single focal point. Most importantly, crystal lens addresses intermediate vision by accommodation.
What is the lens made out of?
The biconvex lens is made of a material called BioSil, a biocompatible and biodurable third-generation silicone, and there are 2 polyamide flexible loops extensions at the end of each plate. BioSil has been FDA approved.
This material sounds interesting. What are the drawbacks?
Silicone elastomers have great material properties such as surface covering, chemical, and thermal stability. With great material properties, there are drawbacks similar to the stock.
What are the disadvantages and risks of this IOL?
Few patients with crystal lens have experienced glare and halos. It focuses only on image to the back of the eye, unlike a multifocal lens which shows multiple images. Some risk of this IOL is that the crystal lens can get stuck in a forward or backward position, giving good near vision or distant vision, respectively. Also, users are recommended to wear sunglasses because crystal lens does not absorb any significant amount of UV light.
Well, thank you guys. Now that you heard about the 4 companies, which company do you choose?
Well, after considering the pros and cons of the devices, I have decided to choose the NanoFlex Collamer IOL offered by Star because it is most biocompatible of all devices due to its pure collagen content, and in addition, I can see both near and far ranges.
Now there you have it, folks. Now let's say goodbye to our wonderful guests.
Thank you very much, Oprah. It was very good to see you.
Oh, thank you for coming and watching my show. If you have cataracts and you are still unsure about having IOL implants, you can assure yourself that intraocular lenses are still improving. Current research are being conducted to find ways to increase the rotational stability of the intraocular lens, to reduce secondary vision loss due to PCL, and to allow IOL users to see various distance, not just near or far, but also intermediate distance. Not only are they improving on the device, but they are also improving on the surgery procedure to reduce infection and inflammation. Now, free IOLs for everyone!